The number of Americans with high blood pressure is about to rise from about a third of U.S. adults to nearly half. On this week's edition of Today's Health, we learned that heart disease experts have released new guidelines for treating hypertension at their annual meeting. Erica Edwards has the details.
Hypertension patients and their doctors are going to have to work harder to bring down blood pressure measurements. Heart experts have lowered the target for high blood pressure from 140/90 to 130/80.
We saw the need to update these guidelines to reflect the real threats of high blood pressure,
including heart attacks and stroke. Two heart disease prevention powerhouses, the American Heart Association and American College of Cardiology, issued the new guidelines. Dr. Jeff Williamson of Wake Forest Baptist Medical Center is one of the authors.
These guidelines apply to all ages, especially to those people who have a greater than 10% risk of a stroke, a heart attack, or heart failure in the next 10 years.
So blood pressure's doing okay?
Some patients will need an additional pill to lower their blood pressure further, but the majority will be prescribed lifestyle changes.
If we really could focus on the lifestyles, the weight loss, the exercise, really watching the diet, that makes a big difference in keeping the blood pressure lower.
The guidelines also suggest cutting back on salty foods and increasing intake of potassium-rich fruits and veggies like sweet potatoes, butternut squash, and spinach. Erica Edwards, NBC News.
High blood pressure is treatable, but only if you know you have it. It's often silent, occurring without any signs or symptoms. In other health news this morning, some good news for coffee lovers. A daily cup of Joe may be linked to a lower risk of heart failure and stroke. Researchers at the University of Colorado studied data about what people eat and their cardiovascular health. Those who drank the most coffee were the least likely to develop heart failure or suffer a stroke. Eating a plant-based diet may also lower the risk of heart failure. A study from Mount Sinai Hospital in New York looked at 5 dietary patterns. People who ate a mostly plant-based diet were 42% less likely to develop heart failure than those who ate fewer of these foods. No other dietary patterns were linked to a lower heart failure risk. Finally, Harvard researchers found adults who ate 5 or more servings of nuts a week had a decreased risk of cardiovascular disease. Walnuts were the most beneficial for heart health, but peanuts and tree nuts also had a protective effect. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.